Hello and welcome to Aging Matters, a program provided by the Berks County Area Agency on Aging. My name is Ann Barlet and I'm the Public Advocacy and Outreach Manager for the agency. Our show this evening is on hospice programs, services, benefits, and more. I have two special guests that I'd like to introduce at this time for our show this evening. To my immediate left is Dr. Vinti Shah, and she is the Chief of Palliative Medicine for the Reading Health System. And then next to Dr. Shah is Margaret Patch, and Margaret is currently the user of hospice services and will give us her perspective on hospice services. I would like to let you know that if you have any questions during our show tonight, please feel free to call in. The number here is 610-378-0426. So we've got a lot to cover tonight, so we're going to move right into it. Again, thank you both for being here with us. I'm excited about tonight's show. I think we don't talk enough about hospice and what it is, and I'm glad we're able to share that with the group, with the audience tonight. So, Dr. Shah, I wanted to start with, you said I introduced you as the Chief of Palliative Medicine. So we hear palliative, we hear hospice, so let's talk a little bit about, can you tell us if there is a difference and what that difference is?
Sure. Palliative medicine is actually a specialty of medicine, and I certified in hospice and palliative medicine. Palliative medicine specifically is meant to help patients who are seriously ill or have life-limiting conditions. The purpose of my job or my role is to help these patients have a good quality of life as they're going through their aggressive treatment. So when a patient is going through chemotherapy or hemodialysis and they have pain, nausea, fatigue, my job is to help them through that so that they can better tolerate their treatments and as they're healing. The difference between palliative medicine and hospice is that hospice patients also have these serious life-limiting illnesses, but they've come to terms with their disease, or they've come to a point in their disease where aggressive treatment is not felt to be helpful, or the patient says, look, I know I have this really bad disease, but I'm not sure that I want to go through this aggressive treatment anymore. But that doesn't mean I want to stop all medical care. You know, I want to be comfortable, I want to be peaceful, I want to have a good quality of life. And so hospice is actually a benefit that's provided by Medicare and many private insurers. It consists of nurses, aides, social workers, chaplains, sometimes therapists, nutritionists, and all these people come to where you are, and they all of them report also to a physician. So the purpose of these people is to come to where you are and help you live a good quality of life. And
so since you said that, I like the words come to where you are. Let's explain that, because I think there's a misunderstanding or misconception about where can hospice services be provided where I am. Where might that be?
And so it's interesting because sometimes when I talk to my patients about hospice, they'll say, I don't want to go anywhere. And so I often have to say, hospice is not a place, it is a service. So it can be provided wherever you are. So if you're at home, at your daughter's home, in a nursing home, wherever you call home, hospice will come to you. All
right. And I'm just going to also interject that I've also had a personal experience with some hospice services, and because of the very limited time frame and because of the awareness of the situation with the illness, hospice also was permitted in the hospital.
Yes. So hospice can occur at different stages. For some people, when they are doing really well, hospice occurs at home. But let's say you're at home, or you develop really bad symptoms that can't be managed at home. You're feeling very sick. Or you're in a hospital and you are at a point where you're not safe to be moved. At that point, we will do hospice in the hospital. So sometimes it can happen in a hospital if you are so acutely sick that you cannot be managed at home.
So hospice, I'm glad you said also hospice is services and not the place. So that's also nice to, I think, be reassured of that. And you talked about the benefit, it's a benefit of Medicare. So explain then to us, so that Medicare pays for that? Is it all of it, a piece of it, versus what I have to pay, or other types of insurances?
So with different insurances, you always have to check your coverage benefit. But as far as Medicare goes, Medicare covers the entire hospice benefit. So all the care team members that I described earlier, that's covered. Durable medical equipment, let's say you need a hospital bed, you need oxygen, you need bedside commode, that is covered. Medications that are related to comfort, so if you have pain medicine is covered. If you have nausea medication is covered. So the medication, durable medical equipment, all the people I talked about, all of that is covered by the hospice benefit. So you do not pay out of pocket for that. But it's always good to check with your primary care physician who can help you figure out what the coverage is for you as far as private insurance companies.
Or check again with your insurance company.
Absolutely.
The type of insurance that you have they can share also the different benefits that are covered through that. Okay. So looking at that, you mentioned about all the different types of services, but before I get into that, what I'd like to ask is, again, the combination of the folks that are involved with providing the services in terms of, I guess where do I start?
Sure.
Maybe we need to start there with, I can't just call up and say, hey, come on over. We've got to identify when the hospice services are appropriate, at what stage, and then how is that put together for somebody who is experiencing the need to have that?
So first and foremost, it begins with you. You have to be ready to say, I think it's time. And that is a time for you to talk to your physician, your oncologist, or whoever your trusted medical provider is. And you typically, based on Medicare requirements, have to have 2 physicians feel that you're hospice appropriate. And once those physicians feel that you're hospice appropriate, it's as simple as them making a referral once you pick an agency. Once the hospice agency gets your name and contact information, they'll reach out to you and they will meet you where you are. And that's when you enroll in hospice. Once you enroll in hospice, that's when all the people that I talked about start coming to you and providing care for you. What's really interesting, unique, and I think really special about hospice is that your care plan is never static. So let's say this week you're feeling really well, the nurse may come say hello to you, check your symptoms, and then she'll go. But let's say that 3 days from now, all of a sudden you develop really bad shortness of breath or really bad anxiety, then your care plan will change just as quickly. The nurse is in contact with the physician, and they'll make the adjustments fairly quickly. Medicare requires, and I know this, I used to be a hospice physician, but Medicare requires that the entire interdisciplinary team meet and talk about you. So that means your nurse, your aide, your physician, your chaplain, your social worker, they all sit around a table. And I know this because I've participated in many meetings. And it's a really interesting conversation because it's so multifaceted. We talk about the social needs, the emotional needs, the spiritual needs of a patient, and that's how your care plan is formulated.
Which I would also think that changes over time.
Absolutely.
I'm going to stop there just for a second because I understand we have a home viewer. So we'll go to the home viewer. Good evening, home viewer. And you have a question?
Yes, good evening. I have a question for you. If I do have veterans in Pennsylvania here who require hospice care, is there a location for them in Berks County to go to if they require hospice care, or if there would be an area like maybe they'd have to go to the Veterans Hospital in Lebanon, or is there any facilities in Berks County for veterans who were in the military who are retired, let's say in their 60s and 70s? Is there a place for them to go in case they require hospice care? That's my question. I'm going to listen to the answer.
All right,
Thank you.
thank you for calling in. I think it almost goes back to something that we started the show with, as far as the gentleman was asking, is there a place to go specifically for veterans for hospice services, for hospice care?
So the first thing you want to do is figure out whether you have, whether you're enrolled with the Veterans Coverage. There are facilities, as he pointed out, Lebanon. There is a hospice unit at the Lebanon VA, and I have transferred patients there. The thing about the hospice unit there, though, again, for an inpatient hospice unit, you do have to be fairly ill and you have to have that requirement. So for patients who are doing okay in the community, that's not the place you want to be. So if your question is, once I get really sick and I need inpatient level of hospice support via nursing staff, then you can check into the Lebanon VA hospice facility. I believe there's also another one within Berks County, but I'm not sure where that one is.
And what we can say with that is perhaps the Veterans Affairs Office may know better is if the different Lebanon VA, if the different VA hospitals have areas, and you can call the local VA. I don't have the number with me off the top of my head, but you can call our agency and I can give you that. There's also a veteran service officer in our agency on a Wednesday. But the other piece of that, I think, is I'm glad you explained that if the person felt really ill or maybe alone, I wanted to make sure they felt safe and could perhaps go to a place. But the other key that you said is it's in-home services. It can come to you in your home. So you don't necessarily need to go somewhere per se. You could stay in your home if that was the good alternative for you to stay in your home and receive the services in your home.
And that would be just the same as before, as with a non-veteran. You call your primary care physician and they can help arrange for those services.
Okay, good. I hope we've answered the question. Thank you. So getting back to the interdisciplinary team and the fact that you meet, is there a head of the interdisciplinary team? In other words, a person who's kind of saying, okay, I'm seeing the care. Is it the nurse that's overseeing kind of to say, okay, this week, when I was there, this person expressed the need to have some other pieces of the pie put into place?
It's exactly what it is. You just described pieces of a pie. So I think it's a little bit less of a leadership, but more a team approach. So the chaplain owns the spiritual part of the patient's care, the physician owns the medical part of the patient's care, the social worker owns the social part of it. So we are leaders in our specific field and our specific area of specialty. And I think that's how you would want your care. You would want the individual specialist to focus on their aspect of it, but we come together as a team to make sure that all the pieces of the puzzle are fitting together really well.
And meeting the needs, because we're all so different, aren't we? So, I may have a spiritual, you said chaplain, I may have my own spiritual person, my minister or whoever that is that I feel comfortable with, that I may want that support and may not need it through the particular hospice agency that I've chosen, but maybe something else that might be beneficial. Let's talk about, just real briefly, if you could mention again, the nurse that's going to kind of coordinate it. You said with the physician oversight, with the other pieces of the pie, the care, the medications. You mentioned chaplain. What other pieces of the pie are there? Other people that are participating in this team?
So you said nurses, social workers, chaplains, physicians, of course. Anytime a nurse comes to your house and she wants to change her medical orders, she calls the physician right away. There are some hospices have nutritionists, volunteers. So sometimes, we may have patients who just need somebody to sit with them. Oh, the key one, the aides. I'm surprised I forgot about those. What's really nice is that you can get aid support several times a week. So let's say you're doing a great job taking care of your mom, but you need, mom is bedbound. The aides can come, they can help provide with your mom with gentle washing. And so that takes a little bit of the responsibility off of you, which is nice because in that moment you can stop being the caretaker and learn how to be the daughter again, or the brother again, or the spouse again. It's a nice break to have.
One thing I did want to clarify that you mentioned about if it were me and I would be at that stage where I've chosen not to go through treatments and whatever and want to be comfortable and help with along the way, and I could begin? What if I can't? You know, I'm looking at our older adults in our community who may have dementia of some form, who may not be able to communicate that, to say that's what it is, but you have family members who might be power of attorney or others that are caring for that individual. So just want to clarify, so if I am the daughter, the caregiver, I can say, hey, I really do think they need this. My mom needs hospice.
So if a patient has a life-limiting disease but is not able to make their decisions, we call that lacking decision-making capacity. There are two ways to make the decision. If there is an official medical power of attorney or a healthcare agent, that person can make the decision safely, and it's legally acceptable for them to do that. If a patient has never designated that, then there's actually a Pennsylvania law that we rely on called Act 169, and that sets a hierarchy of who can make the decisions if the patient has not previously chosen somebody to be their medical power of attorney. And that brings us to a really important point, you know, even if you don't have a life-limiting illness, even if you don't have a serious medical condition now, the truth is that at some point we are all going to get sick. We are all going to die. It is really important to do two things. One, have a conversation with your loved ones about the type of care you would or would not want. And two, designate a medical power of attorney or a healthcare agent. Say to a person, look, I care for you and I trust you to make my decisions for me. These are the kind of decisions I would want you to make in the event that I got sick, and this is important for everybody.
Thank you for pointing that out, because I think, you know, as our agency does outreach to the community, and I hear a lot of individual stories, and not just on hospice, but all kinds of other situations, and most times, as an adult child of an older adult talking to me about they don't have this and they don't have that, I always say to them, you hear this? Please take care of it for yourself. Make sure that you are opening the conversation with your own family at least, so that we're all getting in that mode of being able to talk about some things, what we want, what we wish, and I think that's important. So thank you for pointing that out. What I am going to ask also is right now is, before we get to Margaret, real quick, what would you say? You know, we've talked about a whole lot, and we could certainly take an hour or more. In terms of hospice, and you said it was changing and evolving, so in most cases, if I am the caregiver, and I think we need to clarify that hospice services support, I guess is the word I'm looking for, the individual receiving the services, but also the caregiver. In other words, the hospice services with those aides that you talked about are really not around the clock. This is not the substitute caregiver. Is that correct? Could you just touch on that real quick?
Sure. So hospice is an added layer of support. So when we say added layer of support, that doesn't mean that they're the primary caretakers. So hospice provides the supportive services to help care for your loved ones, but they don't do what we call custodial care. So they're not there 24 hours a day. So the regular caretaking of your family members is still your responsibility. So whether you split that between you and other family members or other friends, somebody else should still be there to care for your loved one 24 hours a day.
Thank you.
Yep, and you know, I work for Reading Health, and I'm very lucky to have fantastic social workers who help address that. But definitely talk to your primary care physician if you're not able to help your loved one 24 hours a day. And it is a big task.
It is, and I think you do need to have a lot of resources available, whether it is having that social worker really help you kind of go through some things and make, well, how am I going to cover this piece and this piece, or if I have to work or I don't have to work, but my family member can come in here, and all of those pieces. That's a great assistance, I believe. So I'm gonna move on now a little bit, and then if we need to wrap up and come back with Dr. Shah with maybe one last sentence of something about hospice. But I'd like to bring in Margaret, Margaret Patch again. Thank you for also being here with me. And I think what's really good about this is that Margaret's had 2 experiences with hospice, one for her husband in the past, and currently her mother is receiving hospice services, and you would consider yourself the primary caregiver with the support of hospice services, right?
Yes, my sister and I are caring for her
Okay.
in her home.
Okay, so she's receiving it in her own
Yes.
home. And I guess what I would ask you is, where did you start? You know, I mean, you had some past experience, but, you know, really, what did you do?
If I could do a soundbite important message, I did not enter this with all the answers. And there are sources to find out. I went on the internet. I found the Office of Aging website. I downloaded the list of hospices.
Okay.
I did not go to mother's physician and say, is it time? I have a background in procurement, so I interviewed, I selected 3 hospices.
Okay. All right.
I was looking for 24-hour access to the
Okay.
hospice.
And clarify, access, I like the way you
Yes.
put that, versus care. In other
Yes.
words, you understood that it wasn't going to be 24-hour
Right.
care, but knowing that if you needed to contact somebody
Yes.
at an off hour, we'll
Yes.
say, good,
Yes.
okay, thank you.
So that was important to me. And then I had representatives from each hospice come into our home, and I interviewed them because I was looking for the chemistry with
Okay.
both my mother and with us. And I learned as I went along. I'm of a generation right now where it's a topic of conversation of my peers, and they've either done it, are doing it, or are facing it. So there was also, well, what have you heard about this one? What do you know about that one? And so on.
Okay, so I like the approach that you took. I mean, you really got the list, again, that our agency has. So I do want to make note that we do have a list of hospice agencies that you can get by calling our agency at 610-478-6500. We'll send that out to you, or as you mentioned, on our website, and that's www.berksaging.org, with a list of those, and again, printed out. I'm glad to hear you interviewed them. You didn't just pick
I even got
the one that's located locally, you know.
No, I got the questions online because I Googled what to
Okay.
ask to select
Okay.
a hospice.
Okay.
So that was very helpful. And I didn't know if mother was ready for hospice. Hospice evaluated her and said yes.
Okay,
And they have criteria.
Okay.
And mother fit the criteria.
all right.
And then I went back to her physician and said, okay, here we are, here you are, would you please?
And then he ordered
Yes.
hospice
Yes.
services.
Yes.
So now, may I ask how long your mother has been receiving hospice services?
Since May.
So I don't get.
And she's just been recertified. So they do
So-
a periodic assessment.
Okay, all righty. So it's not like, okay, once you've hit so many months or such a long period of time, they will reevaluate and you can
Yes.
continue.
Yes.
And at the same time, is it not true that should you improve, that
Yes.
can also, you can come off hospice services, or I believe at any time, should you decide, I don't want hospice services anymore, you can stop?
Yes.
Okay. What I wanted to ask is also, you mentioned, Margaret, about, others, talking to each other and, what are you doing, what are you doing? Could you tell me some of the things you've heard, maybe from your friends or that you've experienced, to want to say to everybody about, I call it misconceptions.
Yes.
Just to clarify that doesn't seem to be real out there correctly, that I was hoping to straighten out with Dr. Shah's presentation and your information.
What I hear too often is it going to cost me more money?
Okay.
We're already in approaching whatever resources our parent had, and we can't afford more. So that's one concern. The other one is, well, they're not going to die in the next 2 weeks. I got hospice care for my late husband, and it turned out to be 6 months, but I wanted hospice people to bond with him so that when he needed them at critical care, it was an established relationship.
Sure.
And I'm just so touched by both the nurse and the aides that we have with our hospice
Okay.
that are loving and giving and kind.
And that's what
And
you
my
want.
mother
I mean,
smiles when they walk in the room.
Good, good. So we did hear that it's a benefit of Medicare,
Yes.
so not to worry about some costs. And if nothing else, I guess I would say ask questions.
Yes.
You interviewed, but you also wanted the bond. Also know that it's evolving and changing in care, as Dr. Shah mentioned, and that we can ask questions. I don't understand this. Why are you doing that? What's happening now? One of the other things I wanted to ask you before we run out of time is, we talked about the different services of benefits, but I want to ask you the benefits that you've seen given to your mother receiving hospice, and then to you as one of the primary caregivers.
The aides and the nurse have modeled behavior for me.
Okay.
And I'm in awe of these aides that go from house to institution that remain calm and gentle and caring. I've learned how to turn. I've learned a number of skills. And so I'm a better caregiver when they're not there because of what I've learned from them.
Okay, good. And since you have access 24 hours, you're comfortable knowing that you can call them at an off hour should you have
Yes.
there's a change in something,
Yes.
a quick question, you're not
Yes.
sure, and they've responded.
Yes.
Okay. There was one other thing that I kind of wanted to just say, but I'm gonna give you 30 seconds of our minute, and then I'll get back to Dr. Shah. What would you like to share if you had one kind of thing to say about utilizing hospice services?
In both cases, when I've used hospice, I am at peace that I cared for my husband and now my mother
Okay.
to the best of my ability.
Okay. Good. Thank you. And also, I think that you and I were speaking earlier, and I wanted to say that you also have sought out some other in-home care
Yes.
to also
Yes.
supplement
Yes.
for yourself the caregiving piece,
Yes.
which can also be done in addition. So thank you. And Dr. Shah, and I guess in the last minute that we have, what would you like to say that we may have missed, or something important that you'd like to share?
I don't think we missed anything, but here's what I say. When a mom is pregnant and getting ready to deliver, we nurture that newborn life because it is so precious. And I think hospice gives us that opportunity to nurture that same life towards the very last moment. It is a very beautiful and peaceful experience.
That's lovely.
What more can I say? Thank you so much. I appreciate both of you being here as my guests,
Thank you.
Dr. Shah and Margaret Patch. Thank you so much for tuning in, and good night.